Hi, today I will be presenting on the topic unilateral body neglect. This is an after effect of stroke. So, what is unilateral body neglect? It is the inability to integrate and use perception from one, usually the left side of the body. It is a condition that occurs after damage to one brain hemisphere, where the person becomes unaware of and inattentive to one side of the body. This is usually the side opposite to the half of the brain that was damaged. For example, a right CVA stroke causing left neglect. The defect may occur independently of visual field cuts or visual inattention, or may be compounded by both defects. Left neglect is much more common than right neglect. Unilateral body neglect can also be referred to as hemi-neglect, hemi-partial neglect, hemi-inattention, and so on and so forth. For the sake of clarity, this presentation will stick to unilateral left neglect, or UBN. Now, what are the characteristics of UBN? It is consistent inattention to stimuli on the affected side, the inadequate self-care by the client or the patient. It is lack or neglect of looking on the affected side. Patients also leave food on the affected side because they are not aware that it's there. They bump into objects on the affected side and may neglect to wash, clean, or put the affected arm into a sleeve or shirt sleeve while dressing, or only shave, and they may only shave one half of their face. They often keep their head turned away from the neglected side, while food on that side is usually left untouched. Often, individual is not aware that the food is there. The person may walk or propel wheelchair into the walls or door frames on the neglected side. Now, what are the effects of UBN? It is potentially dangerous for the person due to impaired midline orientation and postural control during mobility. Wheelchair collision and falls may occur towards the affected side. The neglect can alter the recovery of the affected side too. The motor recovery in a hemiparetic arm is much more likely to occur when the patient can attempt to use the side. If the side is completely ignored and only the uninvolved side is used, chances for regaining of the affected side are very low. This could lead to a debilitating loss of independence in ADLs, which makes treatment of the condition even more important. Now, what are the treatments for unilateral body neglect? Choosing the right treatment approach depends on several factors, including time of onset, progression of symptoms, patient's level of functioning, and improved performance on a single task. For instance, visual scanning can help patients to read but may not help in other ADLs. There are various approaches to the treatment of UBN, including restorative or remedial approach and adaptive or compensatory approach. It is important to avoid the big mistake of just repeating "look to the left" repeatedly to the patient. When planning intervention, though, consider the degree of the client's recognition impairment, that is, their ability to orient in space. Also, subcategorization that clients fall under, their motor and visual defects or impairment, and the different therapeutic method that affects the subtype. Now, using the adaptive or compensatory approach. The compensatory or adaptive approach forms the basis of the rehabilitative frame of reference, in which the aim is to modify the demand a tax places on the person. This may include the provision of assistive equipment and aids. including 1. Educating the client and his family about the individual's unilateral body neglect and how it will affect function. Train the family in how to assist the client in affected self-care tasks to compensate. Also, highlight activities where safety is an issue. Provide visual cues or reminder to the client, that is, putting a sign on the mirror reading, have I shaved both sides of my face in the morning when they're, showering or dressing? Or have I washed both arms? This will help them to remember to do all this. Also provide verbal cueing to the clients during self-care tasks as needed to compensate for body neglect. Train client to self-monitor his performance by asking, have I put each arm through a sleeve? Have I shaved both sides of my face? Client can have a daily activity checklist to monitor his performance after task completion. Now, using a restorative approach, we can do the following. Apply concepts from neurodevelopmental frame of reference by asking client to participate in bilateral activities to facilitate increased body awareness. Also encourage the use of affected side during ADLs as much as possible if client has movement in the extremities. Do this by using hand over hand, guiding to help them to use the spoon, wash their face and body, brush their hair, and so on. We can set up activities that will force the use of the neglected extremity. Performing ADLs in front of a full-size mirror to draw attention to the affected side will also help a lot. This can help to provide visual feedback and can help in mid-line orientation, as it can help correct leaning posture when full body is in view. We can provide tactile or proprioceptive stimulation to the affected side prior to self-care tasks. Therapists can rub affected arm of client while client watches, using either his or her own hand, a rough cloth, or vibrator. We can ask client to rub himself with his uninvolved hand while he watches in the mirror. Client ranges himself in front of a mirror to see what is the activity going on. Another method is anchoring. Anchoring is another restorative approach during which client is instructed by prompting to scan to the affected side by providing visual cues like bright sticky notes or colored tape. We can train client to scan using the mental imagery of the lighthouse panning to the anchor back and forth, just like in the lighthouse. We can give that mental imagery while they practice turning left to right. We can always sit when we're treating them at the affected side when doing therapeutic activities. So this can help cue the individual to look more towards the affected side. Other stuff that we could do for them to be aware to keep, attention on that side is, placing their TV near the affected side, the remote control, probably turning their bed towards that affected side so that when they're coming out of their bed, they're coming out from the affected side. So visual scanning is another method, this includes activities like letter cancellation, worksheet, or word finds. Vibrations to the affected side during the rest breaks could provide more sensory input. There are two recent approaches added. The first one is the eye patch or the partial visual occlusion. Now, this is not a confirmed research. Research is still going on to affirm that this method works. Now, Aria and friends in 1997 performed an experiment with 10 participants with the left neglect to force the use of the neglected eyes. Partial visual occlusion includes placing a patch over the non-neglect half of the visual field of the client's glasses or providing them with hemiparesis glasses. Have a clear lens and a shaded lens which reduces the amount of visual stimulus entering the non-neglected visual field. In the line cancellation and bisection tags and figure copy tags, ARIA found out that 4 out of 10 participants who were in the experiment showed improvement. Like I said, the research is still ongoing to affirm that this method works. Another recent research is the constraint-induced therapy, known as CIT. This originated from research with animal by Taube in 1980. He found out that monkeys with unilateral four-limb differentiation tended not to use the differentiated limb. He and his crew implemented a program that involved shaping technique to train the monkeys to use the affected limb. The success of the program led to the belief that it could be used to rehabilitate persons who have suffered strokes. The patient is asked to put on a sling or splint on their unaffected arm and carry out a series of simple and complex movement tasks. For example, brushing teeth with the paralyzed arm. After 2 years, the study found that the number of activities the subjects could perform increased. Another method is wearing a glove on the unaffected arm, while the client used the affected arm to carry out simple and complex activities. But this was not as effective as the splint, as the patients are more likely to use the unaffected arm due to lack of proper restraint. Below are some pictures of some CIT tools that were used. The glasses, the hemispecial glasses, the sling, and the glove. Thank you.